And joining us now from Louisville, Kentucky, the Senate Minority Leader Mitch McConnell. Senator McConnell, thanks so much for joining us.
Good morning, Jack.
Well, turning back to the terror attack or the attempted terror attack, the Obama administration was following procedures established by the Bush administration in the creation of the TSA. Are they doing enough? Does more need to be done?
Well, our leader on this issue, Senator Susan Collins of Maine, suggested to me yesterday when we were talking about this, a question she's going to be asking, which is how does a person on the terrorism watch list get a U.S. visa? I mean, particularly when you consider that his father was concerned about his son's proclivities this fall. I think there's much to investigate here. In addition to that, he obviously had some kind of connections with Yemen. And we know that there was an imam in Yemen who may have been the inspiration for the Fort Hood attack. There's much to investigate here. It's amazing to me that an individual like this, who is sending out so many signals, could end up getting on a plane going to the U.S.
Do you think individuals who are on either of the two terrorism databases that Robert Gibbs referred to, do you think that they should automatically be at the very least subjected to additional security searches at airports?
It only makes common sense.
All right. Well, turning to health care reform, which is another big issue on the plate of the administration and, of course, on your plate as well. You've been criticized by several conservative voices, Rush Limbaugh, Eric Erickson at RedState.com, and others, for not doing enough to stop health care reform. As the Senate Democrats passed the bill, you said, "This fight isn't over. My colleagues and I will work to stop this bill from becoming law." So what are you going to do, and what can you do with only 40 votes?
Well, first, every single Republican opposed the measure. All of the procedural devices that are available to slow down a measure were employed. It didn't pass until Christmas Eve at 7 a.m. The American people are overwhelmingly opposed to the bill. I'm not sure what's to criticize about that from a conservative point of view. And, of course, the bill is not law yet. It's still got to be reconciled between the House and Senate. There are deep differences among Democrats. Every single Democrat in the Senate provided the one vote that passed this 2,700-page monstrosity that cuts Medicare by $500 billion, raises taxes by $500 billion, and instead of curbing the rate of increase of insurance premiums, most Americans' insurance premiums are going to go up. This bill is a colossal failure, and that's why the American people were literally screaming at us, please don't pass this bill.
You criticize this bill for cutting Medicare, and there are Medicare cuts in this. A Medicare Advantage is cut, doctors' fees are cut 21% next year. But you have a history also of voting for Medicare cuts as well. In a 1995 deficit reduction plan, you voted to cut Medicare by $270 billion. In a 1996 budget resolution, you voted to cut it $158 billion. And in the 1997 Balanced Budget Act, you voted to slow its growth by $393 billion. How do you square those votes from when Senate Republicans ran the Senate with your current criticism of the bill for cutting Medicare?
Easily. Those reductions were related to making the Medicare program itself, which is going broke in 7 years, more sustainable. What they're doing here is using Medicare as a piggy bank. They're taking $500 billion out of Medicare, not to save Medicare or make it more sustainable, but to spend it on a new entitlement program for a whole different set of Americans. So we don't think you ought to take grandma's Medicare and start a new program for someone else.
Do you think that Republicans running for Senate in 2010 should run on a platform of vowing to repeal the health care reform bill should it become law? And will that be one of your first items should you regain the control of the Senate, repealing what you guys call Obamacare?
Well, certainly politically, it's a big problem for them. They all kind of joined hands and went off the cliff together. Every single Democrat provided the vote that passed it in the Senate. You've seen what's happened already with Congressman Parker Griffith in Alabama switching parties. There are rumors there may be others. There's great unrest in the Democratic Party, and the reason for that is the surveys indicate the American people are overwhelmingly opposed to this effort to have the government take over all of their health care. It will be a huge political issue next year. And that's why you hear the Democrats saying, let's don't tackle any more big issues. I mean, I was reading an article this morning indicating they don't want to do cap and trade anymore. They're nervous about financial re-regulation. And what they understand is the new administration and the new Congress has squandered its goodwill with the American people, leading to what could be a big setback for them a year from now.
Respectfully, sir, you didn't answer my question, which is, should Republicans campaign on a platform of repealing the health care reform measure, and will that be one of the first items on your agenda should you become the new Senate Majority Leader after the 2010 elections?
Well, I'm sorry, I thought I did answer your question. There's no question that this bill, if it were to become law, and frankly, even if it doesn't become law, will be a big, if not central issue, not only in the 2010 election, but in the 2012 election.
All right, well, I'll take that as a yes, that they should campaign on repealing Obamacare. You cut a deal with Harry Reid to secure a vote on the debt limit issue for the first week that Congress returns, a standalone vote on the debt limit plus 5 Republican amendments. Why was that important to you?
Well, look, this administration has run up more debt in its first year than the previous one in 4 years. They passed a budget that will double the debt in 5 years, triple it in 10. Raising the debt ceiling is no longer an automatic. This is the nation's credit card we're talking about. And so we think it's important to have a debate with amendments about what we intend to try to accomplish for the American people to get this debt down. Americans are scared that their children are no longer going to have the kind of country they've had because of this burgeoning national debt. And raising the debt ceiling is a good time to have that debate.
The Congressional Budget Office says that the health care reform bill will actually reduce the deficit by $132 billion. But there's also this criticism from Bruce Bartlett, an official in the administrations of Ronald Reagan and George H.W. Bush, who wrote in a Forbes magazine article titled Republican Deficit Hypocrisy that the 2003 Medicare prescription drug benefit offered by the Republican Senate was a, quote, pure giveaway that, quote, had no dedicated financing, no offsets, no revenue raisers, 100% of the cost simply added to the federal budget deficit. Quote, as far as I'm concerned, any Republican who voted for the Medicare drug benefit has no right to criticize anything the Democrats have done in terms of adding to the national debt. Senator, you voted for that Medicare prescription drug benefit, which some say will cost $1 trillion over 10 years and was not offset by revenue or spending cuts.
Well, the first thing you should notice that it came in 30% under budget because of the competitive mechanisms that are involved in extending a prescription drug benefit to seniors. The Democrats criticized it at the time because it wasn't generous enough. And look, they have gone far beyond any deficit spending indiscretions that Republicans might have had. In their first year alone, they ran the deficit up more than the last 4 years of the Bush administration combined. Enough is enough. The American people are expecting us to stop this effort to spend, tax, and borrow us into oblivion, which has been going on for the last 12 months.
All right, Senator Mitch McConnell, have a good holiday. Thanks so much for joining us.
Same to you, Jake.